who have joined us today. First, Dr. Lynn George, Dean of our College of Health and Wellness. Dr. George is a graduate of Indiana University of Pennsylvania with her BSN, the University of Pittsburgh with her MSN, and Duquesne University, her PhD. Dr. George teaches in the graduate programs in Carlow's College of Health and Wellness and serves on several nursing advisory boards. She is currently chair of the board of directors for Heritage Valley Health of Mehall, who serves as the respiratory care program chair within the College of Health and Wellness. He obtained his master's degree in education with a concentration in instructional and curriculum design from AIU University. He received his undergraduate Bachelor of Science degree in respiratory therapy from Wheeling University. And last but not least, Dr. Renee Ingel. Dr. Ingel is an associate professor in the doctoral and MSN programs in the Department of Nursing at Carlow. Her primary interest is in health promotion and illness prevention through community and personal health and wellness. Dr. Ingel's PhD is from the University of Pittsburgh, and she has an MSN degree from Carlow. I'm going to turn it over now to Dr. Lynn George to make some opening remarks.
Welcome, everyone. It's my pleasure to welcome you to this event that is featuring our Carlow alum who are on the front lines of COVID-19. We're very proud to call them Carlow grads, as well as to call all of you who are our alum Carlow grads. And it's time to move on with the program, and we'll be ready and willing to answer your questions as available moving forward. Michael?
Oh, thank you. Hi, my name is Mike Mehall. I'm the Respiratory Care Program Chair at Carlow University. And I was asked to participate in this particular event, mainly because, you know, I have been in contact with a number of our program graduates out in the field. And I wanted to highlight some of the incredible work that they are doing, simply heroic things, you know, that they're doing on a daily basis. And I felt compelled that we needed to bring this, you know, to light to the community, and just some of the fantastic things that they are doing out there. One of my graduates from 2019, Zach Talley, is joining us today. And I've been in conversations with Mr. Talley quite a bit. And I am just amazed at some of the incredible work that he and some of the other the graduates are doing out there in the field. And I know that this goes across all the health fields. So I don't want to minimize them at all. But you know, I wanted to focus a little bit of the attention on some of the masterful things that Mr. Talley is doing out there in the field. Zach Talley is, as I mentioned, a 2019 graduate. He works in critical care within the UPMC system. And, you know, I thank Zach for all that he does. And I'd like to turn the microphone over and the attention on to him, and rightfully so, along with the other you know, frontline healthcare workers. So I'll turn it over to Mr. Talley.
Thanks. So my name is Zachary Talley. I'm a 2019 graduate from Carlow Respiratory Program. So just some quick things. This is definitely a team effort for everything within the hospital, all the way down to even people that clean the rooms, throughout everything. We have been working together I work at UPMC Mercy Hospital. So we've been working out through different roles every day, all day. Sorry, you gotta bear with it. I've been on night shift for the last 2 weeks, so a little bit tired today. So we have been changing protocol left and right. It changes by the minute right now, just because of all the new stuff coming up. there, this, that. So it's been a tough time trying to adjust on the fly, but we're kind of making it work. A lot of it has to do with just like I said, the teamwork. The teamwork is a major part of all this and how we're going to get through this, and especially not even the healthcare workers. It also has to do with the people staying in and doing the social distancing themselves and participating everywhere across the board.
Zach, this is Lynn George. Could you tell us a little bit about how you worked with Mr. Mehall to come up with a very creative solution to help protect those who were on the front lines to limit their exposure related to the use of monitoring the ventilators?
Oh, so our ventilators, our servo eye ventilators, we have a big part with them that we can actually take off the head monitor from the actual ventilator and place it outside the room. And we can attach our IV pole we can attach it to IV poles along with even the nursing pumps, which are great. So it actually limits us going into the room every time that we have to change a tiny thing, and it actually saves us on the PPE as well.
Great. Have you shared that with the rest of the facilities that are part of your network?
Yes, it's been posted a lot on Facebook and on like all the critical care things that we've been managing and trying to keep up with everyone else.
So you were the creative genius behind this.
More so Mike.
Together, you were the creative geniuses behind
You
this.
were.
Thanks, Zach.
That is a very important thing to note, because it drastically reduces down the exposure for the patient, for the personnel, because literally Zach took the top of the ventilator off, and in some of our lab procedures, we actually go over that inside of the machine, there's a 20-foot extension cord that can be uncoiled in cases, rare cases such as this, that you want to limit exposure. And Zach had the initiative to recall that, extended it outside of the room, and just think of the simple things such as the amount of PPE equipment that they've saved, the additional exposure to personnel. It is a very, very creative use of Zach's abilities and his ingenuity, and it really is an important thing. And they've utilized this, from what I understand, in other areas as well. So kudos to him. Incredible work. Absolutely incredible.
It looks like
I
there's
couldn't agree more. Go ahead, Lynn. Go ahead.
No, I was going to say a question popped up for Zach at the bottom of the screen. Zach, the question is, what's one of the most difficult things about your role in this pandemic?
So it's definitely, our patients are suffering from, of course, an upper respiratory virus going around right now. And it's the most difficult part right now is trying to manage our pressures in our lungs, in our patients' lungs. So there's been a big research that aerosolizing this virus can make it almost go airborne, as people could say. And they're saying that we're trying to limit as much aerosolization as we can. So we've been trying to do with MDIs, meter dose inhalers. So like the puffers you see traditionally. So we're not doing any breathing treatments, just the MDIs. And then even with the most difficult part right now is definitely intubations, assisting with intubations, because there's only a select amount of people in the room. And once you're in that room, you're in that room. You don't have time to go back out. You can't go back out to get any supplies. So that's when you got to rely on your team again.
Great, Zach. Very proud of the work you're doing.
Thank you, Zach. You are doing amazing work, and we're grateful for your expertise and your innovation and your ability to recall what you learned in the classroom. Thank you, Dr. Mehall, for for teaching so well. We're going to come back to you, Zach, in a few minutes with some additional questions, but I want to turn it over to Dr. Ingel to introduce Sara.
Good afternoon, everybody. Thank you for attending. We are honored to be with two of our frontline workers as they have done so much to facilitate successful management of the COVID-19. I am going to read what was sent to me by a leader at the Allegheny Health Network regarding Sara Angelilli, who is one of the frontline nurses that graduated from Carlow. This message says, Sara has been working tirelessly on preparing the N95 mask reusable recycling project, in addition to the respirator project below. AHN received a donation of respirator masks that needed to be distributed, and Sara had developed the education and the plan for distribution across the network. She has been phenomenal. So I'd like to introduce Sara so she can give you her perspective on management of the COVID-19 and open it up to questions from the nursing perspective. Sara, welcome, and thank you for all you're doing.
Sure. Thank you guys so much. I'm so excited to be with you today, and thank you for this opportunity. So, like was mentioned in the introduction there, we have been very fortunate through our health network that our staff do have the PPE that they need to take care of these patients. And part of that, we are working behind the scenes to ensure that we get extended use out of our N95 masks. So as part of that, we worked with our company, Sara, who sought FDA approval to re-sterilize N95 masks, extending their use for 2 additional uses, which is fantastic news for us. But even better than that, we are holding on to those masks for 2 reasons. The first is that we still have N95 masks that are coming into our warehouse for distribution. So we have new masks for staff to wear, but in addition to that, through a partnership with 2 people from executive leadership, we have been able to work with a local industrial company and source N100 filtration masks that we are currently working to deploy out to staff. So this hasn't gone out for press release. You guys are at the front line of hearing what is going on the inside, and we are just thankful for the resources and connections that we have to keep our staff members safe.
Terrific.
Sara?
That's terrific. Go ahead, Renee.
I was going to ask Sara the same thing. What's the most difficult part of your work on the front lines of COVID-19?
I think that it's the speed at which everything is changing. We have such great team members, and everybody has stepped up to the plate, much like Zachary said, and you're doing fantastic work at UPMC. It's having everybody be flexible to change and pivot as fast as the new information is coming. But the teams are fantastic, and we couldn't ask for anything better.
Sara, there's another question that came through the chat box for you. What have you found, if anything, that is rewarding to be on the front lines?
So I'm really supporting all of the frontline members and ensuring with our surgical oversight team and PPE committee that everybody has what they need to take care of these patients. So for me, it's really making sure that everybody is safe to do their job so that they can care for these patients.
Great. We have another question, and I'll defer to Zach or Sara. How are the hospitals keeping the virus away from patients that might be there for another procedure, having a baby, and knee surgery, etc.? Can you, either of you, talk to that?
Go ahead, Sara.
So in our areas, as all of the hospitals in the Pittsburgh region, we have limited visitors, and we are limiting the amount of surgeries that happen so that we can better control transport of patients to make sure that there is no cross-contamination. I know in a number of the COVID units, they are creating them as negative pressure rooms and negative pressure units, which is new for us as well, to ensure that the virus is not getting out of those units in places where we are transporting other patients.
Also,
go ahead, Zach.
So another quick thing. So to protect patients, our therapists have been the people that have been down in the COVID unit or the MSICU has been only down there, and they won't go and see other patients throughout the day. Just the ones that are down there. That makes sense.
That makes sense. Can you talk a little bit about maybe mental health of your fellow workers, and even for yourself, how you're coping with going into the hospital setting day after day? What kind of toll that might be taking on you or your fellow coworkers?
Definitely tiredness. You can see it. You can start seeing it in other people's eyes. Let alone you look at yourself in the mirror and you're like, wow, I should probably get some sleep. Yeah, definitely. Main thing would be tiredness. I see another question down here about being afraid of contracting the virus. I think more so spreading it to our family members and our friends, people that we live with. I think that's the biggest concern that most medical people have. Sure, I mean, who wouldn't be scared to catch a virus like this? So everyone's going to be a little bit scared, but we're still going to do everything we can for these patients.
Thank you for that. Thank you for that. And you are both heroes, along with all the other medical professionals in our community and in our country. We have another question about protocol. What protocol do you follow when you return home so as not to spread the virus?
So I think right now it's more, they just assume that we're smart enough to just change our clothes, and everyone has like their own protocol at home. Some people get sprayed off with a hose walking in the door before they walk in the door. My protocol, and my girlfriend also as well works with COVID patients as well. So we kind of have a household that we definitely need a protocol for ourselves. We change scrubs and everything before we come home from work, and our policy for us is go straight to the shower.
Great.
Yeah,
Sara?
I would agree with that. So some of our units where there are high frequency contacts with patients that have COVID, they are giving those units hospital laundered scrubs. So those staff members would wear street clothes in, change into a pair of hospital laundered scrubs, and then change before they go home. But same thing as Zach, for me personally, I put everything in the washer as soon as I get home and take a shower before I touch or do anything else.
Terrific, thank you. Thank you. You're giving a lot of compliments about the inspiration that you are to our audience, and thank you for all you do, your bravery, and for sharing your knowledge. People are very, very appreciative of all you're doing. Are there any other questions out there? I think did I cover?
While you're waiting for more questions to come in, I can also speak to the part about taking care of yourself and mental health. Our hospitals have started to create, they're calling them different things, but basically a mental health oasis. So there is a room dedicated in the facility where staff can go to decompress, where there's nice music playing and lavender scent diffusing into the air, and some of them have chocolate, so that staff can get away and take care of themselves throughout the day. And then, of course, it's kind of the basics for us. So making sure that we're taking care of ourselves with good nutrition, hydration, sleep and then some quiet time, whether that's meditation or prayer or reading.
Oh, that's great. Well, I see a few more questions, but before I go to them, I want to interject my own on, is there anything that we can be doing, we as the Carlow community, for local workers like yourself in the hospital setting? I know someone, a colleague whose daughter sent pizza delivery to a friend of hers who works at a hospital out of state. Is there anything that we can do as a community to really show our concern, our care, our love to support you and others in the hospital setting?
We're never going to say no to food. There's been a little running joke that we're going to gain the COVID-19 pounds because of how much food we've been receiving left, right. Not just food, candy, snacks, chips, dips, you name it. I think it's come across our tables. But honestly, just be there for someone to talk to within the medical field, because it's not going to be right now. People aren't going to be telling stories, much stories, but it's going to be later whenever this starts to hit more towards home and like mentally.
Mm-hmm. Good. Sara, anything to add to that?
No, I agree. I think that the food has been underestimated at how helpful that is, because that's one less thing that the staff members have to think about while they are in there doing the work that they need to do. So hospitals really, really appreciate all of the food donations that have been coming in, and we're just thankful for any support that is offered.
That's great. We have a question about how difficult is it to keep patients' families informed of their loved ones' progress, since people can't go in and visit these patients. Can either of you speak to that?
From my point, I don't specifically talk to family members unless they're actually in the hospital, but since there's been no family members, I have not been in direct contact with the patient's families. But I know the nurses and the doctors, they will call, they'll answer calls, anything, but we give out pins, so like you must have the pin. I think that's like a universal thing that everyone does.
Yeah. And we have, in addition, asked some of our donors who are coming to us saying, what can we do to support, or foundation members, if we can use some of their funds to purchase iPads so that we can allow the patient that time with their family member and they can communicate via Zoom calls or FaceTime, whatever they have access to, and they can get that little extra bit of assurance.
So Sara, who would individuals contact if they wanted to make such a donation?
That's a great question. I will find that out and I can email it to you to get you the right person.
Terrific. We have another question. Could either of you answer this? How are hospitals working collaboratively to provide the best evidence-based care?
Within the UPMC system, I know a lot of the CCM doctors, critical care management doctors, will discuss between themselves, and a lot of our CCMs work in between hospitals. So they bring back protocols left from Presby. Montefiore Pass event right now is a big one. So yeah, most of our CCM doctors are intertwined in the system, so they're informed on all the hospitals.
Great.
Yeah, I agree with that too. At our hospital, this has been a great point of unification where we have been able to bring leaders together virtually to discuss best practice and bring these ideas together and support people with a unified message. So just like Zach's saying, we are going to the leaders, whether it is critical care or through the ANPD or other organizations, and bringing those ideas back to vet them and keep everybody in the loop as much as possible.
Collaboration at its finest. That's terrific. We do have a question about, I lost it now, had to do with masks. Are hospitals accepting, I guess, homemade masks? Someone wanted to know that.
I know this would be a better answer for Sara, but I know from Mercy we are not accepting homemade masks or cloth masks. We are accepting like the 3M N95 donation masks.
Agree. I'm not 100% sure, but I can check on that as well.
Okay, thank you. There are messages of prayers for the safety and strength to you and your coworkers. We have Lynn, Renee, or Mr. Mehall, Dr. Mehall, is there anything else you would like to add to this discussion before we complete our webinar today?
This is Lynn, and I just want to reiterate how proud I am to have graduates like Zachary and Sara on the front lines, and their stories are demonstrating how well prepared they were for something that we never could have imagined, and how adaptable they are. And I'm really grateful to them for the work that they're doing, the support that they're giving to patients and families, and to them and all healthcare providers who are going to make sure that we get through this. And I appreciated the comment in the beginning from one of them, I can't remember. They're working on the front lines. We need to stay at home, and that's how we can help them to avoid having surges that occurred in other places. And I'm very impressed with their creativity and their dedication to their professions.
Thank you.
Well said, Lynn. Well said. Thank you very much. I was hoping before we end today, if I know most of you in the audience, we can't see your videos, but I would like to take the opportunity, if you're willing, to put your video screen on, and I'd like to get a screenshot of all the participants in today's video, if you're so willing. So I'm going to give a few seconds to wait and see if our audience will put their screens on so we can get a screenshot, and we're going to share this via social media.
I would also like to provide a big thank you to Zach and to Sara and all the individuals working on the front lines. Their dedication, their passion, and everything that they are doing is simply heroic in my opinion. So I would just like to send a big thank you to them and all the individuals that they're associated with, because you know, it's incredible the work that they are doing. It simply is. You know, I'm humbled just to listen to some of the stories from Zach and Sara, and you know, I feel like that I'm not doing enough myself. But you know, I just simply wanted to say thank you. Thank you for all that you're doing.
Thank you.
And while I give a few more seconds for people to put their videos on, I just want to echo my thanks as well. I want to thank you both for being here today. I want to thank Dr. Lynn George, Dr. Renee Ingel, and Dr. Michael Mehall for being here today with us, taking time out of your day to share these remarkable stories. And again, echoing your dedication, we thank you for being on the front lines right now to support our community, our region, and we are very proud of both of you for all of your hard work.
Thank you.
Thank you for this opportunity.
I also just want to
My
say
pleasure.
thank you to you guys for definitely teaching like that big impact. Definitely taught us everything we need to know and definitely prepared us beyond imaginable for this.
I agree.
That's great, terrific. So next week, please join us next Wednesday to hear from Tim Phillips, Vice President for Student Affairs, for an update on our student life activities. And again, thank you all for joining us today, and have a wonderful Wednesday. See you next week.
Thank you.
Thank you.